I'm Dr. Richard U. Levine, President of Columbia Doctors. Columbia Doctors are the 1,200 doctors who are part of Columbia University. We are the largest multi-specialty group on the East Coast. Columbia Doctors Eastside is located at 16 East 60th Street between Madison and Fifth Avenues. This is a very convenient midtown location.
Say the word mop.
Mop.
I hope you'll take the time to meet many of the doctors who practice here.
So we're going to get started.
When I was in college, I decided that I had a fascination with medicine and health, mostly human physiology, and I wanted to pursue that further. So I attended Columbia University College of Physicians and Surgeons Medical School, and I couldn't give up any part of the body. So I decided to stick with the skin, which encompasses almost all the body parts and allows me to treat the entire person.
Don't let them move, keep them right there. I started at Columbia Presbyterian 44 years ago. That's perfect. There's the common human equation. When a patient's got chest pain and they can't breathe properly, the anxiety and the symptom is always the same, and the help is the same, and the medical approach to it is the same.
I came here in 1967 and did a 5-year residency in obstetrics and gynecology. So I want you to take big deep breaths in and out through your mouth. Now, one of my great satisfactions is when I see one of my babies coming in and I have to take care of her as a young woman or as an adult.
Part of the things I like about being a doctor is there's a very large investigative approach. You sort of feel like a detective. People come to you with problems, with complaints, and you try to figure out what actually is going on with them and then set up a plan to make them feel better and live longer. Everything looks perfectly normal. It's really important to make patients feel comfortable. You feeling okay? You need to develop a trust between the two of you. Perfect. Sometimes it comes right away, sometimes it doesn't.
People are pretty straightforward and they want to be made to feel comfortable. So you work in the building?
Yes.
The relationship I have with my patients with a lot of them, it's really close. Your patients bring a lot of fear to the dental office. They bring a lot of fear to doctors in general, but I think to the dentist office, there's a lot. The small acts that we have of bonding with our patients, not cosmetic bonding, but just the bonding that we have with our patients is important to the overall, I think, outcome.
I mean, I think the number one reason they come here is because it's Columbia University and they know they're going to get good care and they're going to get top of the line physicians.
The 3 babies are moving okay, not a problem with any other babies.
What I tell the staff and everyone else, at the end of the day, you want somebody to treat you the way you want it to be treated, or you want your family to be treated.
So we want patients, when they walk into our office, to feel comfortable. That's why we have the bright colors, we have, toys on the tables. We're trying to take the fear out of going to the doctor. So my favorite part is having that relationship with the patients and their parents, and just really helping them help the children grow and into their adulthood.
I'm going to want some of the patients to be scheduled for us. As the leader of Columbia Doctors, I'm really excited about making us work more efficiently as a multi-specialty group. What's special about Columbia Doctors Eastside is not only is it a beautiful facility, but it's a facility where there are many specialties present. It's kind of like one-stop shopping.
So I'm a dermatologic surgeon, and I did an extra year of training after dermatology to specialize in dermatologic surgery. And that includes skin cancer treatment, which is called Mohs micrographic surgery, and it's a specialized type of skin cancer treatment that we control the margins microscopically. I feel like it's my job to really hold the patient's hand, help them through it, help them to understand that this is a skin cancer, but that we can treat it, and that it's my personal goal to make it as cosmetically perfect as possible.
I've been at Columbia for over 27 years now and have enjoyed my time here immensely.
Is this itching at all?
If there's some specific thing that is very bothersome to them, then sometimes we can take a different approach in our testing and evaluation. So we do try to customize what we do to what makes our patients comfortable and will still give the best possible information for them.
Okay, I'm going to take a look in your throat, and then I'm going to do a culture. Okay.
I think some people don't realize that nurse practitioners are able to practice independently. At least they are in New York. Your tonsils are pretty enlarged and kind of red. We diagnose and manage illnesses. We order all sorts of radiology procedures and laboratory procedures, and we can prescribe medications, even controlled substances.
Hi, Ms. Miller. I specialize in headache and facial pain. Probably the most common disorder I see is migraines, but often patients seek headache specialists because they have daily migraines or a chronic daily headache. I love it when the patients come back and they tell me they're feeling better. That's why I do it, is to hear that positive response that I made someone's day better.
So I'm a pediatric otolaryngologist. A brother and a sister. So I deal with kids aged 0 to 21 years of age with all things of the head and neck, ear, nose, and throat. But specifically, I tend to like things involving pediatric hearing loss, but I also do things involving snoring, sinuses, as well as some airway issues in children. What's great about working at even just Columbia in general is that you're surrounded by excellence, okay? And so you know that if you have a patient who has a problem, and if you're going to help them somewhat, but they have something else that they need help with, you're going to be able to find the answer.
So radiation oncology actually is a critical part of the cancer treatment. And this cancer treatment usually involves in surgery, medical oncology, which is the chemotherapy. But radiation oncology is one of the most important parts that provide the tumor control and locally, and also prevent tumor from spreading out to other part of the body.
Any pain with that? I am involved in athletic disorders, whether it be the adolescent patient, the weekend warrior, the older patient. I deal with injuries involving the shoulder, elbow, knee, and the hip. Any pain with that? There's nothing more satisfying than at the end of the case and knowing that that patient is going to have a great outcome, and then seeing them in the office and watching the progression. In the beginning is usually tough, but when seeing the final product and they're grateful for what you've done for them, that's a great feeling of accomplishment.
There are times when I truly think that I've saved somebody's life, and I've done it with a really advanced but minimally invasive technique, and I can then see that patient afterwards and see their face and know that I've really made a big difference, and the feeling you get when that happens is incomparable.